I am down to my last video. I'm not doing a lecture PowerPoint on breast because we have, as I said, gone over mastitis and several things during the course of the year. I'll just touch on a few things that we need, and I already did that, so we're not going to be doing that. So this sexual transmitted disease is going to be the last one. Be sure to look over your pediatric content. There will be some pediatric questions. A lot of the questions on the exam are going to be management of care and safe and effective care, delegation, prioritizing. There'll be a lot of the, there'll be more renal than there will be in comparison to men and women's health or sexually transmitted diseases. So we are going to go ahead and get started on this. Basically, we are hitting the sexually transmitted diseases. Now, we have talked about sexually transmitted diseases in maternity when we were talking about how it affects pregnancy, how it affects the women, how it affects the fetuses, how it affects the babies. So there are some things that we basically have already gone over. So I'm not going to spend a lot of detailed time on some of the things that we've already had. So if you feel like that you need a refresher, you may want to go back and read this chapter fairly well. We have a lot of public health concerns with sexually transmitted diseases. It's a major health problem. We have things that aren't reported. We have things that are reported. But HPV and herpes doesn't have to be reported, but we know that their incidents are high because of the amount of treatment that we've been given. Chlamydia is probably the most prevalent, highest growing sexually transmitted diseases. So when you have a sexually active teenager, you probably need to test them for chlamydia because it is one of the fastest and largest sexually transmitted disease in the United States. We do have to consider some cultural considerations. Racial groups have the highest burden of sexually transmitted disease are blacks and Hispanics. And of course, the contributing factors are usually poverty, lack of access to health care, high prevalence in the communities they live in. A lot of them don't try to seek medical care. Sexually active black adolescents and young adult women are the most likely to be infected than other populations. And this is kind of, just according to the CDC thing. We have a lot of risk factors that there's a box on what page is it? 1313 for sexually transmitted diseases. And I'm going to let you read those. I don't think I should have to read to you. You are big children, so you know all this good stuff. You can read. So our chlamydia, again, is the most frequently reported disease that we see. It is one of the leading causes of preventable infertility and ectopic pregnancies. About 50% of our teenage girls have contracted chlamydia. And so chlamydia is just really, it has a rate that's 8 times higher in black people than it is in white people. So that's really a sad situation that's going on there. So it's caused by chlamydia trachomatis, and I'm not going to go into big detail, but you can see it's easily see it's transmitted during vaginal, anal, and oral sex. It's one of the main culprits in PID. So there's a picture that shows you what chlamydia looks like, which is not a very pretty picture. And there's a few different strains of it. It's usually often asymptomatic. It's why they don't usually recognize that they have it. chlamydia infection of the cervix is really bad, and you don't really know that you have it until you start having some symptoms that are of an acute infection. That's usually about 3 weeks after exposure. Men will have a clear urethral discharge. Um, there are you may even actually have an infection of the rectum that causes rectal bleeding and discharge from the anus. There's just a lot of stuff going on with the chlamydia. So babies born to mother are usually can be affected with chlamydia. As you remember, they can develop conjunctivitis and pneumonia. So we usually uh, make sure that we give them some erythromycin ointment in their eyes. So the pneumonia may not show up until they're 3 to 11 weeks old. So it's really difficult to keep an eye on that. Gonorrhea is our second most frequent reported one. Gonorrhea has and chlamydia are usually treated together because you usually see them together. Um, they are usually and their tests for both. All the diagnostic tests for all of these diseases are on page 1315 that you can actually look at. Uncomplicated gonorrhea in men is asymptomatic, or it may be kind of like urinary symptoms. Women may be asymptomatic, or they may have a discharge. Newborns also can get an eye infection from the gonorrhea. So chlamydia and gonorrhea both can cause eye infections in infants, and medications that we give for these diseases should be listed somewhere in your book. Here it is on page 1320. Your chlamydia, erythromycin, and doxycycline for chlamydia, and gonorrhea, ceftriaxone. So these are things that usually we treat with the gonorrhea and the chlamydia together. So usually they're taking doxycycline and ceftriaxone. Uh, some of our drugs for trichomonas is Flagyl. Flagyl as should not be taken with alcohol, makes you pretty sick. Pelvic inflammatory disease is usually caused uh, by a sexually transmitted disease, so it's treated the same as with chlamydia and gonorrhea together. Your syphilis is treated with penicillin G. Hasn't changed in 100 years. Antivirals like herpes are the Aclabor family. And then, of course, genital warts, usually they can either use this cream or they can go in and actually do cryo on them and get rid of them. And to prevent the HPV, we can actually give vaccines which will prevent against 4 different types that Gardasil protects against 4 different types of HPV. So all the medications are listed over there if you want to go look at them. Pelvic inflammatory disease usually presents itself as back pain, pelvic pain. The first thing your doctor's going to ask you is your multiple partner. Do you have multiple partners? Have you had sexually transmitted disease? And then they're going to test you for transmitted diseases. They'll put you in the hospital. They'll give you IV antibiotics and treat you for your pelvic inflammatory diseases. Usually, chlamydia and gonorrhea are your culprits, but it can also be caused by others. It's not always caused by sexually transmitted disease. People with the bacterial vaginosis can develop it. So there are some causes that have not been caused by a sexually transmitted disease, but most of the time it is. Our syphilis that we have going on, of course, is an ulcerative bacterial disease, and it is actually caused by a little spiral corkscrew-looking bacteria. Of course, it comes in 4 stages, and primary, secondary, latent, and tertiary. Your primary one usually has a painless, firm ulcer, a chancery, on the presents on either the labia or the penis, and then it goes away. It's very painless. You may not even notice it. This one has a chancery on his lip. So it depends on where you got your exposure to. Secondary syphilis is usually systemic. So during the secondary stage, you may start seeing things, signs and symptoms are with low-grade fever and having a sore throat, maybe some headache. You're going to have a rash over your palms and the soles of your feet. Condylomas, contagion lesion that looks like a wart, may develop over the perineum, inner thigh, even in the anal area. And you may have mucosis patches in the mouth. So they usually will heal in 2 to 10 weeks, but they recur periodically if they're not treated. That latent phase is that can last for several years, where it just lays dormant. Then your tertiary stage is your last stage, and if it develops to this last stage, there's a lot of damage that can be done to the whole body. If it's untreated, the patient's going to die from neurological and cardiovascular complications. We don't see a lot of tertiary syphilis because we do have means to battle it. Congenital syphilis is pretty bad for the babies, and you see this picture here shows the baby that has actually gotten congenital syphilis. Usually they'll have those oral patches around their mouth. They have a skin rash, have some snuffles or some rhinitis going on, and they are actually can be very sick. Congenital syphilis, however, the late onset is not contagious, but it's not a very good thing for your babies to be born with a sexually transmitted disease. Bacterial vaginosis is caused when the normal flora is replaced by overgrowth of any kind of opportunist bacteria. Usually, you're going to see vaginal discharge. That's going to be kind of a grayish, fishy odor with it. Maybe some itching. Usually diagnosed by the vaginal discharge. And usually probiotic therapy will help prevent bacterial vaginosis, but we're not for sure how well that works with them. A chancroid is just an ulcer-forming STI. You can see that down on page 1319. So basically, that's usually on the penis. It's usually on the penis or the scrotum of the male and the vagina of the female. It is not spread from the mother to the fetus, which is awesome. All these bacterial types of sexually transmitted diseases are curable with antibiotics. And your list of antibiotics we've already looked at on page 1320 if you want to look at it again. Education is one of our biggest things. We should, of course, make sure we're asking about any type of antibiotic before allergies before giving any medication for any of these disease processes. PID is a little bit different in that women feel really singled out, that if they have been admitted with PID that makes them look like they're sexually promiscuous, whereas it may have been the husband that was sexually promiscuous. You just never know. So our biggest thing is educate, educate, educate. Make sure they know how that it can be transmitted vaginally, orally, or anally. We have to make sure both partners are treated, what complications each one has, and we've talked about that. People who are sexually active should be routinely screened. And of course, prevention using condom or abstinence is the best way to take care of all of that stuff. So now we have STIs caused by viruses. Now, things that are caused by viruses are not usually curable, and I don't see anything on there that are curable. So our genital herpes, we've talked about this quite a bit. We know it's from lesions. We know that the initial outbreak is going to be the most painful. We know there will be other outbreaks, and Aclavir is one of the things we do to actually help maintain the symptoms. People who have genital herpes should be very careful about having sexual relations. They should always wear a condom to prevent, because you never know when there's going to be a lesion that's active. You could have a cervical lesion and not know that it's there, and you could pass that on to males without really knowing about it. So you should always, if you've got genital herpes, you should be having a condom use. So, then we have the human papillomavirus, which are basically, is the most common one in the United States, and it thinks just about everybody will have, 50% of your population is going to have these at one time in their life. There's 120 different types of HPV. And actually we can, of course, give our vaccines that we have to prevent this, or at least prevent 4 of them. So actually the genital warts are one of the things that we actually will see showing up. So they're showing you a picture of the genital warts in here. We really don't have any tests that's going to tell us if we have HPV. But we do have a PAPS test that we can do with the females and be able to detect if there's any cervical change made from the HPV, because the people with HPV are at high risk for getting cervical cancer. Hepatitis A, B, and C. We've all studied about hepatitis. Hepatitis B is transmitted in the same way that HIV is transmitted. So hepatitis A can also be transmitted orally from food. So how do we medically manage? Of course, I forgot about our acquired immunosyndrome. Of course, AIDS is a result of an infection with HIV, and it is contagious from affected blood transfusion, however you want to look at it, needles, breastfed form from an affected mother. It just attacks our immune system. There are probably 40 new cases every year reported. So all of these are viral. And it's the virus that tends to get us more than the bacteria does. Our medical management with a viral, of course, we want to give antiviral medications, such as with herpes simplex. We can give Aclavir, and we can also do a culture to make sure that the Aclavir is working. But it's not a bacterial infection, so we can only give antiviral. HPV, the warts, we can actually freeze those off and try to make sure that we get rid of them, but they can actually come back even after you freeze them off. So a lot of them will actually just go away. They will just resolve on their own. The best thing we can do is education, what they should report, what they should be looking for. And then we have this other sexually transmitted disease, which is trichomonas. And it is one of the, if you've ever seen it under the microscope, it is one wicked looking little protozoan. It can infest the vagina and urethra and be transmitted, of course, sexually. Usually what we are going to do with Trichomonas is try to eradicate the parasite with flagell, because it is a protozoan. So we usually try to use flagell. Flagell, we have to, of course, be careful, make sure we're teaching them not to be drinking alcohol with the flagell. It's very terrible thing to have, terrible thing to waste. And like I said, we've already talked about some of the things that are going to go on with the breast. Be sure that you look over the pediatric chapter. There are several questions, again, on pediatric things. And let's see, we have talked about urge incontinence. We've talked about renal calculi. Nephrotic syndrome. Please remember the difference. That nephrotic syndrome is probably the only one of your syndromes that is not hypertensive. Nephrotic syndrome does not present with hypertension. It presents with edema. It presents with abdominal pain. And you'll have protein in the urine because it spills, remember, it spills all that protein out. Because it's spilling all the protein out, you're not going to see any of the hypertension because it's not holding like it should. The sodium's going out as well. So we've talked about the diuretics. We've talked extensively about how we can help prevent urinary infection by drinking acidic drinks, making sure we're drinking plenty of fluids to help keep the bladder flushed out. We have talked about the hyperpotassium, what you should look for, dietary restrictions, glomerulonephritis. Anytime we didn't talk about glomerulonephritis, would actually can result in encephalopathy, which is really bad. It can actually, it starts out with headaches, and children are especially susceptible for it to go on into encephalopathy, which is very dangerous and has a high mortality rate. Hydronephrosis, remember the symptoms for that. Know about your Wilms tumor in children. Be sure you know that one. And we've talked about, we just got through talking about trichomonas. Trichomonas can also, because of the particular type of virus that it is, can actually affect the fluid pH. And so what it does is the trichomonas can actually cause your vaginal pH to become acidic, and sperm doesn't like acidic, so it doesn't live very long in there. So, study hard, study your medications, and good luck. Why do you think they're so high? We have so much non-compliance. I just did a group of 10th graders. We did a career day. I pulled out my STD wheel and had them spin the wheel. They knew, the majority did not know what any of the STDs were, what they caused, and how they got them. It's very sad to think that 10th graders are not being educated in how to prevent sexually transmitted diseases. Not so worried so much anymore about pregnancy as we are sexually transmitted diseases.